What's happening, Performance Therapy Nation? This is your host of the On Cue Performance Therapy Podcast, Mike Quintons. This is part 2 of the Return to Sport podcast with the Jersey Duo. In part 1, we discuss approaches for assessment, treatment, and what happens after treatment to reduce the risk of injury. This episode, I will be getting answers to some quick hitter sports medicine questions that we frequently get from parents, patients, PT students, and new grads, all regarding sports medicine. Quick blurb on each of our guests. You can get the full blurb on part 1. This will be, like I said, this is part 2. So Mike St. George is currently the clinic director of Ivy Rehab in Warminster. It's in the sports rehab. What's the name of the location?
Fit Life.
Fit Life. Okay, Fit Life up in Warminster, PA. SFMA, FMS, FCS certified, as well as in the Dorsa V. And then Ryan Stahl is a staff physical therapist and the director of sports performance director for the Ivy Rehab Network, currently treating in Cherry Hill, New Jersey, and has his OCS and is in line to get his SCS, also certified in the Dorsa V. So, which is a new software that we have in the Philadelphia area, clinics, Newtown Square, Media, Ardmore, Berwyn, Warminster, and over in Jersey at the Cherry Hill location.
That's right.
Awesome, fellas. So listen, this is actually, we haven't done an episode like this before, so this will be kind of cool. These are quick hitters, which I know is going to be really hard for Mike St. George, but we'll keep it juicy, but like not too juicy. All right. So BFR, blood flow restriction training, does it work? St. George.
Yes, it works.
Yeah, that was good. No, it definitely works.
Okay, patient population.
Okay, so you're looking at efficiency. So like the protocol says 30, 15, 15, 15. Some of your athletes coming in can't even do that many amount of reps. So I liked a really good cue from Mike Reinhold discussing the topic, talking about added in as maybe an extra burner, added in with some of the exercises, just as an adjunct. That restriction of blood flow and the return will help to stimulate some of the gains. So just kind of do what you can with it. But for some of your higher level population, even for like athletic performance or at the back end of the rehab, you can really tax them hard with it, but it's uncomfortable, but it does work. The research is showing. And I know Trent Nessel's looking at research to see if there is some healing expedited for the ACL graft through using blood flow. So there's some things in the works that are pretty cool.
I was at TSN right before COVID in Denver, Colorado. There was a platform presentation.
On BFR, right?
BFR there was cardiac rehab was up there.
Yeah, cardiac rehab. Yep.
Interesting.
It's muscle, right?
It's a muscle.
Yeah.
As long as they don't have any other like contraindications for like a.
There's evidence that supports it for cardiac rehab. That's wild.
As long as they don't have like peripheral vascular disease,
there's
smoking a pack in reports, so yeah.
Marlboro rolls around here. Actually, it's probably pretty accurate. All right. I'm with you on BFR. Same page. Listen, don't just buy the equipment and use it. Take the course. Know what you're doing.
Definitely
Educate yourself if you're a medical professional, and if you're an athlete, ask questions. Right? Ask questions. How do we know what pressure this should be at? Are you using a Doppler to assess? What the pressure is distally, right? Not just my blood pressure in my arm, but elsewhere around the body. So
don't be lazy.
Don't be lazy. Take the course. Number 1 cause of biomechanical failures for the ACL, Brian.
Oh, dynamic valgus with God, there's so many. I would say dropping into poor knee control, dynamic instability.
Fatigue and velocity on top of poor neuromuscular control.
Where do we most often see the poor neuromuscular control? Like where is that lack of control at? Are we looking like ankle, hip,
core,
trunk?
It's all the core.
Core.
Okay, all right. This is good because a lot of people will say the foot and ankle.
Foot and ankle, yeah, it's a component.
The foot and ankle will fall in line if you get the core aligned.
Number 1 reason why ACL reconstruction fails.
Returning too soon.
Agreed.
All right. Most preventable sports-related injury.
What do you say?
That's a very interesting.
Yeah.
Most preventable sports injury? Ankle sprain? I don't know.
Yeah, you could probably do with that. I mean,
I don't know how I feel about it. Ankle sprain, like you laying on someone's ankle.
Yeah, you can land on someone's ankle.
You can prevent that.
I don't know if there's a.
Preventable meaning like overuse, right? So
Overuse.
I would say elbow pain.
I would just say tendinopathy. If you're doing the right things, you shouldn't get that.
Agreed.
Yeah, that's actually great.
Tendinopathy, yeah.
It's
that's
usually
a good
because,
one.
again, you're just neglecting what needs to be done, and you're
Yeah.
just pushing limits that,
It's a good
yeah.
answer.
Because you
And
can't really
elbow pain
prevent.
usually
You can't really prevent injury.
Yeah.
That's what I'm like wrestling. I'm like,
But tendinopathy is usually done because of what the user is doing, not external. So,
well, you can
the
also
act-
have evidence of tendinopathy and not of pain too. But
yeah, well,
Right.
So-
But yeah, tendinopathy is extremely uncommon, and the age is under 40. I think it's what, remember McShane, we just talked about that. Like you don't see it very often, and when you do, it's neglect. You neglected the injury typically. All right, I like that answer. That's a good one. Top 3 courses every physical therapist in sports medicine should take. Ryan, I'll let you take this one first.
I think you should take an SFMA course. I think it's just a good. It's a different way to think about the body. It's an easy one.
Yeah, well, my shift has changed in top 3, so you could do SFMA, but we are bringing something new to the sports performance, and it's going to be the Kaehler Core continuing education training system. So we could talk more about that and attach some links to the Common Core, but it's something that I do want to introduce to our sports performance team because it is the future, and you could research Robert Kaehler, Olympic level rower in the 80s. Since I've been training with this and using it with my patients, the outcomes is just amazing in their neuromuscular profile and just remapping how they're moving. It just eliminates all those compensatory techniques and survival techniques, and it's just something that has been used for a long time. He's using it with a lot of D1 schools, but you know what? They want to keep it a secret. They don't want the people to know, and that's the truth. They want to know what their training system is, so that's what's making them better. Olympic level athletes, NFL guys, you don't know what's going on behind closed doors. This is one of those secret things, but it's gonna be pretty cool. So when you guys get on it, you'll understand what I'm saying, and we could return to this conversation and be like, wow.
You just gave us the when you're old enough. That's what you just said.
What do you mean?
It's like when you're old enough, we can talk about it.
No, I mean, you gotta have to try it, because you don't understand what I'm talking about now. You have to get it, because you're looking at it and be like, that thing is like a pogo stick, and then you get on it and you'll be like, wow. Because I said the same thing, and then he got me training, and I'm like, this is incredible. It's incredible.
Well, I mean, if you're just looking to get into things, I mean, looking at a different way to clip if you're talking top 3 courses, just for somebody who just might want to start getting interested in, I think that's a great one for people who have been training and are more kind of like know a little bit more of the area. But if you're just kind of looking to get into things, taking an SFMA course is an easy one because it comes back to what we talked about giving somebody the capacity to perform.
And probably a Kevin Wilk or any Northeast Seminars course through like Lenny or Mike Reinhold, just so you could kind of understand the big injuries that you're seeing and just get an understanding of the healing and the tissue and the techniques and all that stuff.
Yep.
Even if it is at a pro level, you could scale it down and understand it for just your high school, college athlete. Because that the pro levels will be moving a little bit faster, but you can understand how to scale that and just understand the things they're doing there.
Love all of those. Seriously, all of them perfect. This isn't one-upping any of them. I think this should be in conversation. A soft tissue course, whether it's Graston, whether it's
definitely.
ART, that's a big component. You just did the HVLA on this next second ago, right? Like I do HVLAs, like I get it, the high velocity, low amplitude manipulations, adjustments, whatever you want to call them.
Definitely take a course with that too.
Important. Soft tissue, more important in my opinion, for a sports medicine population.
Yep. Is it a tissue issue?
Is it a tissue issue? Right. I mean, yes. Is always the answer. One piece of equipment every sports-based PT clinic should have. Go, Mike.
Well, now we're moving forward with some plugs. One piece. It's hard because do you use one tool to build a house? So, it's.
Well, you give one, I give one, and he'll give one, and then get at least
what
get
tool
the
do you
family
need
together.
What tool do you have to have?
I'm going with the Kaehler Core.
Wow, bold. Okay.
Telling you.
All right.
Telling you.
Yeah. When I'm older,
I'll put the money on the table right now.
Handheld dynamometer.
Interesting. Handheld. Yeah, that's it.
Handheld dynamometer.
Assess strength that way.
What other way can we quantify besides our numerical system? Right?
Yeah, that's a good one.
Yeah, handheld dynamometer. And or grip dynamometer.
Man, one piece, yeah, please don't say any more down. Man, one piece, I think this is tough. I didn't think I'd have to answer this too. It's been on me. The arm bike? That's not fun.
No. Well, he mentioned building a house, so I said, well, we gotta get some tools to make at least a
that's
room
the last question
in
I'm
the
gonna
house.
answer. I asked the questions around there. You know what, I'm gonna probably get some beef for this. Some type of landmine tool so you can do landmines. I think that doing landmines you can do any rotational, you can do a press, you can do a pull, you can do lower body, you can do upper body. I think you can, it's with a barbell, but you can do single arm, double arm.
I like it.
All right, cool, yeah. St. George's approval, I'll take that. All right, where am I at? All right, force plates, yes or no? Buy or sell, force plates?
I haven't really used them in my practice, so I've always gotten around it.
It's fair.
We have something similar. It's like a flywheel training. It's called Wheeler Systems. That will actually tell you how much power you're putting out. And I really think that is kind of the future ties in, because now we're understanding the efficiency of each rep and resistance, which is pretty cool. So it ties into the technology. So yeah, I say yeah.
Okay. Ice or heat?
Yes, whatever works, if that's what you want to use.
There's so much more stuff coming out. I mean, if you listen to the Whoop podcast talking about recovery, they're looking at ice to really kind of cool body temperatures, especially after like a high intensity workout. So football, you take an ice bath or a cryo chamber, you want to calm down your metabolic stasis there, and also cooling the skin temperature before going to sleep helps you sleep. That's why they want you to be in a cooler room, better sleep recovery. Heat is usually after, if you're trying to make strength gains, you're doing trying to put on size, bulk, and then you could use heat like hot showers, hot soaks. But there is more research coming out about the infrared saunas, where you go in infrared light, helping with other stuff for preventing disease and just getting all the toxins out of your body. So they both have their implications. You just need to know what your target is,
And when.
Exactly, and when, yeah.
Yeah, next one I was cryotherapy. Buying or selling cryotherapy.
I used it as an method. I found it effective for me.
Yeah.
Again, understanding when that's appropriate, looking at the swelling, understanding where it's at. So yeah, it has its benefits.
Definitely.
Isokinetic testing. Buying or selling.
I don't have one of those pieces of equipment, so we've been able to get by it for a long time with just a handheld dynamometer.
Yeah, I think handheld dynamometer will give us what we need to know, and then it's just one part of the equation. It's one piece, so I wouldn't spend all the money on that machine.
I mean, if you want to get one, if you have a specific thing, like a specific system in place, and you don't want to use a handheld, okay, go for it. But the only time I used that was in school.
So just so our audience knows what isokinetic testing is. Isokinetic testing is when you're isolating a muscle group or a specific movement, and there's resistance that is graded throughout the entire movement, right? So when you use a cable, it's the same resistance throughout. When you use a dumbbell, it's the same resistance throughout. When you use a TheraBand, the resistance changes throughout and becomes more challenging as you shorten the muscle typically, depending on how you're using it. This keeps the resistance, to my understanding, it's modified throughout throughout the movement. Does that make sense? Like it's peak resistance throughout the entire movement, and that's how we can compare your left quad to your right quad for a return to sport, right? Mm-hmm. Which was the gold standard for getting cleared to return to sport, which is an open chain, typically open chain movement, meaning your foot's not on the ground and is not functional.
But again, it's a component.
It's a component.
It's a component.
I don't want to sound like I'm bashing it. I think it's got its place. I don't think we
definitely don't.
It's okay to bash it. I think it's phasing out.
And to say it's phasing out, I don't think that's wrong. I think depending on what the number of other tools you have.
I was gonna say, is it phasing out, or are we just coming up with maybe potentially more efficient, more cost-effective ways to do the same thing?
I think that hits the nail on the head. I think we're just becoming more efficient.
All right, give me one follow for Instagram. St. George, go ahead. Who are you following on Instagram? That who's your must follow on Instagram? Aside from yourself.
For what though? Gotta specify.
For sports medicine related accounts.
Kelly Start.
Supple Leopard.
The Ready State, yeah. I like the stuff he puts out. He'll cover a lot of different things, evaluation techniques, rethinking how you're looking at stuff, exercises, purpose of exercise. He really just covers a lot of foundation and gives you the hard questions. Is what we're doing really working? Are you really assessing the right things? Thinking twice about, your treatment programs. He really makes you look at yourself in the mirror and question stuff, I like it.
I know you're not a huge Instagram guy.
I'm not huge on Instagram. Like I'll go on it and just kind of peek at some things, see what some people are doing. So I kind of follow different people for like different body parts because they're rehab professionals and they specialize in certain things. Like you got Ryan Holt and Macrina for the shoulder. You got Wolf for the shoulder, the ACL. There's another guy. You can look at like barbell physio. Just for like some general good mobility things that you can do. I mean, there's so much content and good content. Like if you know what you're looking for, like on Instagram, and you're seeing certain things, you're like, okay, this seems like it's pretty legitimate. You can basically tease out that somebody's an influencer versus an actual physical therapist doing the right things. So I mean, you can do a combination of things. That's what I like to do. I like to get a nice little big approach on on everybody.
Eric Cressy's
a good one.
Cressy's a great follow.
He's gonna tell you things that probably not gonna want to hear, but it's the truth. Just kind of some of the stuff I drop is things that I learned from him.
Yeah.
The hard conversations we have with parents.
Great podcast.
Yeah.
Love his podcast.
Every Sunday, right?
I listen to it Monday mornings on my way in.
Yeah.
Lenny has awesome content. He talks research, which I like. Ryan Holt keeps it real because he's got his videos. He's got stuff that he does. He showcases his team.
I know Phil Plisky has a lot of good information. I'm not sure if you've heard of Phil Plisky. He's got a good thing too. He does a lot of stuff like FMS and stuff and SFMA stuff too. So he's a good one to follow.
People love the prehab guys.
Prehab guys, yeah.
They have some cool content. They have cool progressions. See who else. I think those are all the ones. You know what? You mentioned Kevin Wilk. I like it. Kevin Wilk's like he's a pioneer, right? Legend. He does a lot of he shows off some cute stuff in the clinic, like of someone hitting the rocker board and they're throwing a ball around, and the rocker board's on a foam pad, and again, I'm not questioning the degree of appropriateness. I'm concerned that people see that like, ooh, I got a special toy in the clinic I can do that with.
Yeah.
How do you know it's appropriate to do that? What testing do you know Kevin Wilk did with his patient before he knew that was appropriate? You follow me?
He just gives you some other options of some dynamic stability, rhythmic stabilization, things to do when you're really trying to challenge your patient a little bit differently than just some of the static exercises or things like that.
The worst thing you can do as a therapist is just look at that and go, I'm just going to do that. Oh, I got a patient. I'm just going to use it. You don't know everything that led up to that. I mean, they're doing it. It could be a fantastic exercise for that patient because they don't have good control or something like that. But assess it before you do it.
It's the beauty of social media. I commented on one of Lenny's posts before, and he liked it. He gave me a thumbs up. You know what I mean? And so I can DM him and maybe ask him, hey, but what did you do?
You can. He'll respond to DMs.
He will.
How cool is that? I can message Kevin Wilk and like he is way, 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 way out of my league. And there's a chance he may respond and be like, oh, I did this with him before, or I thought this was appropriate to do. Like, that's cool. So please do that if you're listening and you want to do cool things with your patients. Last question. One book you would recommend. What's a must read?
I don't really have that much time.
You're a supple upper guy. I'm shocked you didn't drop that right away.
Again, you have to understand the appropriateness of that. Even Kelly will say that. He's like, people say, well, can you just mobilize and just do a supple leopard move, just mobilize? And it's like, no, you can't just do that with everything. And CrossFit thought that was going to be a quick cleanup of their things, but there's so many principles. He's given ideas of how to address situations. You need to understand the context of that,
In terms of books to read, I mean, I wouldn't say that I've learned anything from books. It's all from virtual courses and stuff like that.
All right.
So
I guess I'm just an old book reader. I would say.
Are you talking about for physical therapy?
Yeah,
or are you talking
PT.
About,
you got a different book
Just, I mean, you can never go wrong about leadership and ownership. I mean, the Jocko stuff, Jocko Willink, right?
Oh, yeah.
There you go.
He's always good with his extreme ownership,
All right, there you go. Extreme ownership. What do you got?
Yeah, I mean, again, if I'm not reading a research article or something like that, I just haven't really sat down and read books. I'm just always on the go and so active, And
I bought the Mulligan book. I thought the Mulligan book was really interesting to me because it helped me understand the concepts behind.
Did you like how
that's what
he
you're
wrote it
reading
too?
on a Sunday night?
What's up?
That's what you're reading on
I was
Sunday
probably
night?
2 years out when I read this.
Okay.
I was going to take the course and I read the book and I'm like, the concepts are fine. I mean, I can understand these concepts. I can mobilize a joint through the range of motion in which it's restricted or limited, right?
Yeah.
I mean, there's soft tissue involved too with that, but I think that helped me with joint mobilizations for sure. Because to mobilize an open chain was the only way, or an open pack position was the only way to do it, right? That's completely incorrect. So
I think I read that in my last rotation in PT school. I think my CI was like, I think he just told me the Mulligan course. He was like, you should probably read this book. Yeah, it changes. I would say it changes a little
We
bit.
got the notice flashcards in the back with every muscle
Nice,
attachment.
yeah.
Oh, yeah.
And nerve attachment and or innervation.
Yeah.
Origin, insertion, function. So, all right. What else you guys got? Those are my quick hitters. You guys got anything else to add?
I mean, I'll just finish by saying, like, look, even, as much as we joke around and stuff, even if you don't want to believe what I'm saying, if you don't think 11 years of experience is that much, I mean, I'm always very self-critical. I've totally revamped my training treatment philosophy just within over the past 2 years, and I'm still doing it. I'm still learning. I like what Larry Fitzgerald said on a podcast. His grandmother said, once you stop staying humble, you will stumble. So I'm always believing that. So all the hard stuff I drop here, I look at myself in the mirror and ask myself that. I've gone through all these progressions. I've had to accept that what I was doing wasn't working. I failed multiple times. I'm even going to do that with my own training, which is why I'm pushing you guys to get introduced to the column core, because it opened my eyes to something that I was not aware of. And instead of wasting my time doing things that are not as effective, I want to be more effective. But I've also brought in things like learning from people. Like when we do our podcast, I learned a ton of stuff. Or when we were really shut down for the pandemic, Joe and I did a lot of the podcasts over the Zoom, and I learned a lot from other people and understanding, like, if I'm going to the next decade of my career, how do I get better here? And that's really what we're trying to help people here. I'm not trying to sell you a pack of energy drinks. No offense to any of those reps, but I'm trying to help you. I'm trying to help your daughter. I'm trying to make you better. And there's people that give you friction on that. And it's like, look, I can't force you to do this, but I want to give you as much education and as much tools so you can understand why. All these things we're talking about are going to help people understand why. So the same thing, being a parent now, Q and I are both parents, Ryan, maybe some point, right? You don't have kids?
No,
okay, yeah. So it's our job to protect our kids. I don't understand why as a parent you want to see your kid in pain. I don't understand that. Why you want to see that. I don't know if it's you just want to live, vicariously through them, or what you want to do, but when you see your kid in pain, like, why would you want to see that? I'm trying to help them basically get out of that and do what they want to love without being burnt out. And another thing I want to leave is parents sometimes don't understand what's going on with their kids. We know how complex teenagers can be, even college students. When they're away from that pressure of their kid and they come into the clinic, we see a different side of them. And they sometimes say and they sometimes confess things to us that parents aren't aware of. And parents need to hear this and understand what's going on with your child. That they're burnt out, that they're miserable, that I don't have any time to do anything besides soccer. Listen to your kid. Like, why would you do that to your own kid? You spent all this hard work raising them and they get to this point to do what? To watch them be in pain? I mean, come on, let's get real here. We're trying to change this. Nobody wants to go through an ACL tear. Definitely not a second tear. I mean, it's time consuming, it's money. Why would you want to see your kids spend their teenage years doing that? So all this comes back to we're trying to help, we're trying to change it, and we're trying to do it not only for our company, but also for our profession. We have to increase the value of what PTs are doing, and we can't just sit here and say, well, I'm a PT, I'm great, I'm a doctor. We need to show it. So this podcast and all these educational tools are what's going to help that, but also what we're doing in the clinic. So that's what we're trying to put together. So that's what I'll kind of leave for everybody to kind of mull over. Remember, Monday morning message.
Monday morning. I guess as just a last snippet, for maybe new grads who are watching, people who are interested in, it's kind of like you said, you have to be humble enough to accept what you can't do, or humble enough to know where your lane is. Be confident in what you do because of what you know. But really, when it just comes to athletics and performance, if for any parents who are listening, it's okay to ask these questions to your rehabilitation specialists, to your strength and conditioning coaches, to question why we're doing what we're doing. If they're able to answer it, fantastic. That's what they should be able to do. They should be able to answer why they're doing certain things. And if they can't, you may want to question potentially what you're doing, because I know I question myself every day. I question myself every day, and what I'm doing is what I'm doing effective. And like I said, as a therapist, you have to be humble enough to eat that and make yourself better. So we're just trying to help make everybody's day better, everybody's week better, and everybody's performance on the field a hell of a lot better. So we hope that you take at least some part of what we're saying to heart here, because there's going to be times where there's going to be harder times than there are potentially right now. So
this is interesting. It's turned into like a message to parents.
It is.
I like people could go and see George. I like that. Here's my message. It's okay to say no. You can say no. You can say no. You're not going to play on 3 baseball teams this year. You can say no. You can't play 5 different sports in the same season. It's okay to say, no. So that's okay. All right. So that's my big message, and it's okay to ask questions.
Definitely okay to ask questions.
Ask more freaking questions. Advocate. It's your own fault. It's your own fault if you don't advocate. don't assume anything, right? You're making an ass out of you and me. So this has been awesome, guys. Part 2 wrapped up. Contact info real quick. Go for it, St. George. Just like episode 1. But contact info.
So you find Mike St. George on LinkedIn, and then on Instagram, honeybadger_juicy. Good, Ryan.
No, you can just find me on LinkedIn, Ryan Stahl, Stahl.
All right, cool. That's a wrap.